All right, so today we're going to be taking a deep dive into something pretty big in the world of psychedelic therapy.
Mhm.
Um, the FDA recently rejected Lykos' application for MDMA to treat PTSD. And I think this is something a lot of people have been following really closely, so we're going to unpack what happened, why it matters, and what it might mean for the future of this whole field.
Yeah, it's been a wild ride, that's for sure, for anyone who's excited about the potential of MDMA. You have this substance that's often associated with recreational use and partying, but early studies are showing some real promise when it comes to treating PTSD, which is a really complex and difficult condition to treat. But as with any new treatment, the FDA, they have these super strict requirements before they're going to give it the green light.
Yeah, and it seems like the FDA's main concerns is that they need more long-term data before they can really get behind this. We've got some sources here that lay out a few of their concerns. One of the big ones seems to be around drug interactions, especially with patients who are already taking other psychiatric medications.
Right, that's a huge issue that needs more research. We need to be absolutely sure that MDMA is safe to use alongside other treatments. And another thing the FDA is worried about is the potential for cognitive problems down the road. There's been some research showing that people who've used MDMA recreationally might have some cognitive difficulties later on. So the big question is, does that same risk apply when MDMA is being used in a therapeutic setting?
Yeah, that makes things a lot more complicated. It's not like studying a new type of pain reliever or something.
Yeah.
It's really hard to do a truly blind study when you're dealing with a drug like MDMA. The effects are just so unique. How do you even design a placebo for an experience that can be so profoundly emotional and introspective for people?
Yeah, exactly. It's a massive challenge to come up with a placebo that's really convincing for MDMA. And then on top of that, you have to consider that not everyone reacts to it in the same way.
Right, we were talking about this earlier, this whole idea of personalized medicine. Some of the research is suggesting that your genes could play a role, and even the bacteria in your gut might influence how your body handles MDMA. I mean, it's crazy to think that one person might have a completely different experience than someone else on the exact same dose.
Oh, it's absolutely mind-blowing when you really stop and think about it. Your gut microbiome, which is like trillions of bacteria living in your digestive system, it's in constant communication with your brain, and that communication can actually impact how your body responds to medications. That's why some scientists are starting to think that we might be able to actually predict how someone will react to MDMA based on what their gut bacteria looks like. It's like tailoring the treatment to your own unique internal ecosystem.
Wow, that would be incredible. So instead of this one-size-fits-all approach, you could actually analyze a patient's genes and their gut microbiome, and then use that information to figure out the best dosage and the best type of therapy for them. It's almost like custom designing a treatment plan, which is amazing.
Yeah, that's really the future of medicine as a whole, understanding those individual variations. But we have to be careful, too, and remember that MDMA does come with some risks.
For sure, our sources mention some downsides, like potential cardiovascular effects, like your heart rate and blood pressure increasing. And there's the risk of overheating,
Hmm.
and even the potential for some psychological distress. It's not something to be taken lightly.
Definitely not. And that's where this idea of set and setting is super important. That basically refers to someone's mindset going into the experience and the environment where the MDMA is given. It's absolutely crucial to have a safe and supportive setting and to make sure everything is carefully controlled to minimize those risks. That way you can create a positive therapeutic experience.
So it sounds like even though the FDA's rejection might seem like a setback, it's actually pushing researchers to think more critically about how to develop effective treatment protocols and, of course, how to ensure patient safety. It's like they're saying, hey, we see the potential here, but let's make sure we're doing this the right way.
Yeah, I think that's a really good way to put it. And Lykos and other companies that are working in this field, they're already taking steps to try to address these concerns. They're refining their studies, they're extending those follow-up periods and really trying to dig into the nuances of how MDMA is interacting with both the body and the mind.
So it's not the end of the road for MDMA-assisted therapy. It's more like a detour on the path to getting it to the people who really need it. But I'm curious, what do you think this rejection says about the FDA's overall stance on psychedelic therapy? Are they starting to warm up to the idea, or are they still pretty hesitant?
It's hard to say for sure. On the one hand, they're definitely being cautious. They want to see that rigorous evidence before they approve any psychedelic-assisted treatment. I mean, their job is to protect the public, so that's understandable. But on the other hand, they are engaging with this research. They're providing feedback. And that suggests that they're at least open to the possibility.
Yeah, it's a tough balance they have to strike. But speaking of balance, one of the things that really struck me in our research was This need to balance the potential benefits of MDMA-assisted therapy with the potential risks.
Oh, absolutely. The early studies have been promising, but we still have so much to learn about the long-term effects of using MDMA in this way. It's not a magic bullet, and it's super important for people to have realistic expectations and to understand both sides of the coin.
Exactly. And that's actually a perfect segue into something I think a lot of our listeners are wondering about. What happens next? Where do we go from here? And what can people do if they're interested in learning more about MDMA-assisted therapy or even participating in research?
Those are all great questions, and we're going to explore those in a lot more detail in the next part of our deep dive. We'll be looking at the path forward for MDMA research, talking about the ethical considerations that need to be addressed, and we'll discuss how you can stay up to date on all the latest developments in this rapidly evolving field.
All right, folks, so stay tuned. We'll be right back with more insights in just a moment. So before the break, we were talking about this really exciting but also kind of uncertain future for MDMA-assisted therapy, especially after the FDA's recent decision. So let's dig into what happens now. What's the path forward for research? What are some of the big questions that scientists are trying to answer?
Well, one of the key areas that researchers are focusing on is how to improve the way we study MDMA in the first place. As we discussed, those placebo-controlled trials are tricky, and we need to find better ways to really assess the true impact of this treatment.
Right, that makes sense. And I remember from when we were prepping for this episode that some scientists are looking into something called active placebos. What exactly is that all about?
It's a really fascinating concept. So an active placebo would be designed to mimic some of the physical effects that you get from MDMA, things like an increased heart rate or changes in body temperature, but it wouldn't produce those really profound psychological experiences that people associate with MDMA. That way people in the study wouldn't be as sure about whether they got the real drug or the placebo, and that would hopefully lead to more reliable data.
Oh, that's clever. So it's like giving the control group a little taste of the physical experience of MDMA, but without actually triggering those deep emotional responses, those responses that make MDMA so unique and so powerful.
Exactly. The whole goal is to make it harder for people to guess which group they're in, whether it's the treatment group or the placebo group, and that's just one piece of the puzzle. Another really crucial area of research is personalized medicine. We talked about how your genes and even your gut microbiome might influence how you respond to MDMA. So imagine if we could actually analyze a patient's unique biology and predict how they're going to react to the treatment beforehand.
That would be a game changer, wouldn't it?
Oh,
Not just in terms of how effective the treatment is, but also in terms of safety. If we could know ahead of time if someone is going to be more sensitive to the drug, we could potentially avoid some of those negative side effects.
absolutely. It's all about tailoring the treatment to the individual instead of relying on this one-size-fits-all approach. And that means really understanding those individual differences at a very deep level. We're talking about analyzing genetic markers, looking at the composition of someone's gut bacteria, maybe even considering psychological factors that could play a role. It's really cutting-edge stuff.
It feels like we're on the verge of some really major breakthroughs in personalized medicine. And not just when it comes to psychedelic therapies. This could have implications for all kinds of treatments. But I know that even with all of this exciting research, there are still people who are a bit hesitant about the idea of using MDMA at all. What are some of the ethical concerns that have been raised? And how are researchers trying to address those concerns?
Well, one of the biggest concerns that people have is about informed consent. We have to make absolutely sure that the people who are participating in these studies really understand both the potential risks and the potential benefits of MDMA-assisted therapy. They need to know what they're getting into, and they need to be able to make a truly informed decision without feeling any pressure.
Right. It's not like taking an aspirin for a headache. This is a powerful substance, and it can have some pretty profound effects on your mind. So it's crucial to make sure that people are fully prepared for the experience, and they know that they can choose to stop at any time if they want to.
Exactly. Another ethical consideration is around access and equity. If and when MDMA-assisted therapy becomes more widely available, we need to make sure that everyone who could benefit from it actually has access to it, regardless of their income, their background, or their social status.
That's a really important point. It wouldn't be right to develop these incredible new treatments and then have them only be available to a select few who can afford them. We need to make sure that mental health care is truly accessible to everyone. And while we're on the topic of mental health care, I've been wondering, how does MDMA-assisted therapy actually work? What's happening in the brain during these sessions, and how does that lead to healing from trauma?
That's a great question, and it really gets at what makes MDMA so special. It's not just a matter of popping a pill and all of a sudden you feel better. The MDMA is really being used as a tool to help facilitate the therapy itself. One of the ways it seems to work is by temporarily reducing the activity in the amygdala, which is the part of your brain that's responsible for processing fear and anxiety.
So it's like it's taking the edge off those really intense emotional responses. Those responses that can make it so hard for people with PTSD to even think about their trauma, let alone process it.
Yeah, that's the idea. It's about creating a window of opportunity, a safe space, where people can revisit those traumatic memories without being completely overwhelmed by fear or panic. And at the same time, MDMA is actually boosting activity in other areas of the brain, the areas that are involved in social connection and feelings of empathy.
So it's like creating this ideal brain state for processing trauma, reducing fear and anxiety while increasing feelings of safety and connection.
Exactly. And that allows people to engage with their trauma in a totally new way, to gain new insights, and to start processing those really difficult experiences in a healthier way.
It sounds like it's about creating the right conditions for profound healing to happen.
I think that's a really beautiful way to put it. And that's why the therapist's role in all of this is so incredibly important. They are there to guide the patient through the entire experience, to help them understand what they're feeling, to help them make sense of it all, and ultimately to help them integrate those insights into their everyday lives.
It's this powerful synergy between psychotherapy and pharmacology, using the unique properties of MDMA to really enhance the therapeutic process. But I know another question that a lot of people have is about those long-term effects. What do we know about the potential impact of using MDMA on the brain over time?
That's something that researchers are still actively investigating. We understand the short-term effects pretty well, but we need more data on the long-term implications, especially when we're talking about using MDMA in a therapeutic context.
Right, there have been studies that have shown a potential for things like cognitive decline or memory problems
Right.
in people who have used MDMA recreationally for a long time. But is that something that we need to be worried about when it's being used in these carefully controlled therapy sessions?
That's the million-dollar question, and that's what researchers are trying to figure out. It's possible that the controlled doses and the supportive therapeutic environment might help to minimize those risks, but we need more research to say for sure.
So it all comes down to gathering more evidence, especially that long-term follow-up data from people who have participated in these therapy trials.
Exactly, and that takes time. It's a slow and meticulous process, but it's absolutely essential to ensure both the safety and the effectiveness of this treatment, a treatment that has the potential to be truly life-changing for so many people.
And that brings us right back to the FDA's decision. While it might feel like a delay in the short term, it's really about encouraging researchers to do things the right way, to refine their methods, to gather more solid data, and ultimately to develop a treatment that's both safe and effective.
Yeah, I think that's a great way to look at it. It's not a roadblock. It's more like a challenge that we need to rise to.
Yeah, absolutely. Well, I think it's time to shift gears a little bit and talk about the bigger picture. Where does all of this fit into the larger world of mental health care? Is psychedelic therapy really on the verge of going mainstream? So we've been talking a lot about MDMA, but I kind of want to zoom out a little bit and talk about the bigger picture. Where does all of this fit into the whole landscape of mental health care? I mean, is psychedelic therapy really on the verge of becoming mainstream?
It's a really interesting question and one that's sparking a ton of debate right now. We're seeing this huge resurgence of interest in psychedelics, not just MDMA, but also things like psilocybin, which is the active ingredient in magic mushrooms. And even LSD people are really starting to explore the therapeutic potential of these substances. And it's not just happening in sort of underground circles anymore. You have these really reputable institutions like Johns Hopkins and Imperial College London, where they're doing some serious scientific research in this area.
Yeah, it's a huge shift from how these substances were viewed just a few decades ago. It feels like we're moving away from this place of fear and stigma and towards a more nuanced understanding of how these compounds could actually be used responsibly and in a way that could really help people.
I think that's a great way to put it. And this shift in perspective is opening up all sorts of new possibilities for treating a whole range of mental health conditions. We're not just talking about PTSD anymore. People are looking at psychedelics as potential treatments for depression, anxiety, addiction. Imagine a future where psychedelic-assisted therapy is just a standard part of mental health care, integrated alongside things like traditional psychotherapy and medication.
That's a pretty radical idea,
Yeah.
but it does seem to be gaining some traction.
Yeah.
But what are some of the hurdles that we need to overcome before that vision can actually become a reality?
Well, one of the biggest challenges is the regulatory landscape. Right now, most psychedelics are classified as Schedule I substances in the US, which basically means that the government sees them as having a high potential for abuse and no currently accepted medical use. And that makes it incredibly difficult to do research with these substances. And it also really limits access for people who might benefit from these treatments.
So it sounds like changing those regulations is going to be key to moving this whole field forward.
Absolutely. And there's a growing movement that's pushing for these substances to be rescheduled, especially for research purposes. The argument is that if we can reclassify them, it'll be much easier to conduct those rigorous scientific studies that we need, the studies that can really demonstrate whether these treatments are safe and effective.
Yeah, it's kind of a catch-22, isn't it? We need more research to prove that these treatments work, but it's hard to do the research because of their legal status.
Exactly. But I am cautiously optimistic. We are seeing some progress being made. Oregon recently legalized psilocybin for therapeutic use, and several cities across the U.S. have decriminalized certain psychedelics. So there's this growing momentum, and I think it's really just a matter of time before the regulations catch up.
Yeah, it's definitely an exciting time to be following all of this, but like with any new area of medicine,
Yeah.
there are going to be some challenges along the way, right?
Oh, for sure. I think it's really important to be realistic about the potential downsides, too. Just because something has therapeutic potential doesn't mean it's a magic cure-all. And there's always the risk of these substances being misused or abused, especially if they become more widely available. So we need to be really careful and emphasize responsible use and the importance of working with trained professionals in a safe and supportive setting.
Right. It's not about telling everyone to go out and start experimenting with psychedelics.
Right.
It's about recognizing that these substances, when they're used appropriately and with the right guidance, they could have a truly transformative impact on how we approach mental health care.
I couldn't agree more. It's about expanding our toolkit, exploring new possibilities, and ultimately giving people more options for healing and growth.
And speaking of growth, one of the things that's really stood out to me during this whole deep dive is the incredible potential of personalized medicine. Imagine a future where we can tailor these psychedelic therapies to each individual person based on their own unique biology and psychology.
That's the dream, isn't it? And I actually think it's within our reach. As we learn more about how our genes, our gut microbiome, all these different factors, as we learn more about how those things influence how we respond to these substances, we'll be able to develop treatment protocols that are much more targeted and effective.
It's like this idea of precision medicine, but applied to the world of psychedelic therapy.
Exactly. And that's something to be really excited about. It's about moving away from this one-size-fits-all model and really recognizing the inherent complexity of human beings.
Well, I don't know about you, but I'm feeling pretty optimistic. Despite the setbacks, there's this real sense of momentum building in this field. It feels like we're on the cusp of something really groundbreaking.
I totally agree. We're at this tipping point. And while there's still work to do more research, changing those regulations, making sure that access is equitable, the future of psychedelic therapy looks incredibly promising.
So for everyone listening out there who's intrigued by all of this, I encourage you to stay curious. Keep learning. Keep those conversations going. The more we understand about the potential and the challenges of psychedelic therapy, the better equipped we'll be to create a future where these treatments can be used safely and effectively to help people alleviate suffering and live happier, healthier lives.
I think that's a perfect note to end on. It's been a fascinating conversation, and I really appreciate the opportunity to dive into this topic with you and with our listeners.
Thanks so much for joining us today. And to everyone listening, thank you for diving deep with us. We'll be back soon with another episode exploring a whole new topic. Until then, keep those minds curious and stay tuned.